numbing cream. We had him sit with this for about an hour. So we came in early and read a magazine and just hung out with us for a while as he had a nice thick layer of numbing cream on. So he should be feeling nice and comfortable during the treatment. Next, I'm going to cleanse your skin with acetone. It just helps prep your skin for the treatment, and it helps degrease your skin from the numbing cream. It smells like rubbing alcohol, so it is a strong smell, but it dissipates pretty quickly. You wipe your skin with a surgical prep. It's just a nice antiseptic, kills any bacteria, and just preps your skin for the procedure. We just make sure that the skin is nice and clean and prepped before we get started. We removed all that numbing cream. Your protective eyewear, they're these little stickers. They're just going to go right over your eye, and they adhere to the eye so that you can move and your eyewear won't fall off. And there is an actual little laser shield in the sticker, so your eye is fully protected. We're taking measurements of your skin. There's no laser right now, it's just measuring. The machine is so smart that it is taking your exact measurements of your face, calculating them into the machine with the settings I've chosen. And when we select Start, it will save those settings into the machine and deliver that amount of energy for your skin. So the Halo treatment is the first treatment of its kind that produces 2 wavelengths out of the handpiece. It has an ablative wavelength, which just slightly resurfaces the top portion of the skin to help soften your skin, help with pores and texture. And then it has another wavelength that's shooting out at the same time that is non-ablative. And that non-ablative wavelength goes deep into the dermis and helps stimulate collagen. And it's awesome for anti-aging and the integrity of your skin. And so Halo is the first of its kind to combine 2 laser treatments in one. When we do the Halo treatment, we do the skin in the 5 quadrants. So I'm delivering the settings to each area based on the measurements I took for his skin, so it's very customized. And I just work on this quadrant until the timer goes off and tells me that we've delivered the exact amount of energy needed for that area. So then we go to the next quadrant, each quadrant of the forehead, and then the nose.
So how long does the Halo treatment take?
About 45 minutes to an hour, and a lot of that is based on your settings. If you have lighter settings, it doesn't take as long to deliver the energy. Or if you're only doing your face, it doesn't take as long as if you decide to add your neck. You can add your neck and your chest to the service if you'd like to. And so today we've chosen to add his neck to the procedure, so this will probably take about an hour. Now we are on to the other side of his face. You've completed the right side. Following the procedure, he will want to stay out of the sun. We ask, at least for the first 24 to 48 hours, that you really protect your skin, use sunscreen, reschedule that golf game, don't go swimming or hiking or things that involve a lot of intense direct sun. But also remember, for the next 7 to 10 days, your skin is healing, so you still want to be aware of that and protect your skin from the sun. Use a little spring water just to cool your skin. That just keeps you comfortable during the treatment. He does have just a little bit of pinpoint bleeding from the procedure, and that's very normal. That just lets us know that the laser has reached that layer of the dermis. It's a nice end point, and not everybody experiences that, but just is based on the settings, really. Foreheads often will feel just a little bit more sensitive because now we're into areas that have thinner skin. Remember, the cheek areas have a lot more meat on them, so you don't feel it as much as when we get to the forehead. Now, that's because this area is a little bit thinner, but the settings will recognize that this is a thinner area because we're doing a smaller area. So it delivers the right amount of energy into the measurements that we took so he still gets an even result.
What are the benefits of a halo treatment?
Halo will help with the collagen stimulation, and actually when you start to stimulate collagen, it'll continue over the next 3 to 4 months. It continues to remodel. So you'll see the benefits improve over the next several months because we're working from the basement up. But from the surface, he'll see a softening of his skin, the texture improves, reduction in pore size, maybe even a reduction in fine lines or wrinkles, perhaps a little pigment too that is superficial enough that gets sloughed off in the resurfacing. And based on the settings, we can talk about what issues concern you the most and we can adjust accordingly. Take off your goggles now, bring you back into the light. Then I'm going to put on your post-care cream and mix it with a little sunscreen. This is a really thick post-treatment cream. It puts that protective barrier back on your skin. And we will send one of these creams home with you. And I want you to use it at least twice a day, 3 times a day, but you can use it whenever you feel like your skin is tight and dry. Just keep it nice and soft. And of course I'm putting this layer on a lot thicker than you probably will at home because I just want you to have your skin calm down and just feel nice and soothing to you. So
How does that feel?
Very calming and it feels very cool.
good. What he'll expect post-procedure is in a few days his skin is going to feel like sandpaper. He'll get these little dark flecks on his skin and the texture is going to feel really rough and dry. And that's why we send you home with some post-care cream, because it'll help with any itching or tightness and keep your skin soft. But over 7 to 10 days, that will start to wash off as you're washing your face. Don't scrub it or pick it or make it come off sooner. You are able to shave, but if you have an electric razor and you want to use that instead just to kind of trim the hair for the first few days while your skin is maybe a little bit more sensitive, that will help. But you can use a razor over the areas. Just, you know, use your judgment. If it's starting to feel raw or stingy, you know, maybe skip that day of shaving. We tell patients that the neck is usually the last to heal and the last to peel, so it will maybe feel a little bit drier over the next few days than your face does. And a lot of that is because we have more oil glands in our face and it makes your skin feel soft and it just heals it faster. Okay?
Okay.